Okay, hi everyone, good evening. And as our first meeting, I'd like to wish you all a happy new year. For those of you who perhaps don't know me, I'm Councillor Lee Bridge and I'm chair of the Scrutiny Children's Services Review Group. I'll just run through the meeting preamble. So the meeting this evening will be live streamed to the public. A recording of the public part of the meeting will be available on the council's website within 24 hours of the meeting. Remote participants joining the meeting using Teams, please turn cameras on when speaking and use the hands up icon to indicate a question or comment. Turn microphones and cameras off when finished. Those of you in the chamber, please remember to switch microphones on when speaking and speak directly into the microphone and turn off when finished. Also, attendees in the chamber, please make sure that your mobile phones are placed in the silent mode or switched off. If you do need to take a call, please leave the room and return when finished. Okay, so moving on to the next first item on the agenda, which is apologies for absence. I've received apologies from Councillor Alia Khan, and we also have apologies from Councillor Fry, who's being substituted by Councillor David Wynne. Are there any
That's all,
others?
Chair. I haven't received any others. Oh, sorry, Mark Mailer, the secondary school representative. Beg your pardon.
Thank you. Okay, I don't see any hands up, so we'll move on to the next item on the agenda, which is to approve the minutes of the last meeting, the previous meeting. Those minutes were included in the agenda pack, pages 5 to 11. Any comments or corrections on those minutes? I don't see any hands up, so we can consider those approved. Moving on to the next item of the agenda, disclosures of interest. So I will start by declaring that I am a local authority governor of Summaries Junior School. Councillor Keynes.
Governor of Queen Elizabeth and governor of the virtual school.
Councillor Hussain.
Yeah, Downside School.
Any others? Yeah, Ashley.
Sorry, hi. Parent governor Woodmore Primary School, thank you.
Thank you. Good. Okay. Moving on to the next item, when my computer plays ball. Okay, so item 4, any urgent business?
Right, none received, Chair. Thank you.
Thank you. References from other committees and other bodies.
Chair, we've received a reference from the Administration and Regulation Committee on the recruitment of educational psychologists. There's a report contained in the agenda pack. Thank you.
Thank you. So this reference to the committee is included on pages 12 to 13 of your agenda pack, and it's, to cut a long story short, it's basically asking Children's Services Review Group as to whether we wish to call for a report on the topic of educational psychologists and the potential impacts of recruitment challenges on children and young people. I mean, certainly as chair, I think this is probably quite an important topic requiring scrutiny, so I think it should come. I'm seeing a few nods. Perhaps if I could ask for a show of hands for those in favour of that coming to scrutiny. Yeah. Any against? Okay, great. So the decision on that is that will come to scrutiny.
Yeah. So I'm a bit confused by this because I thought there was going to be a report on it already. It came from Regulation Committee, which I thought was going to be a report attached to it. so that we could discuss it. But it's not happened. All we're doing is just nodding.
Yeah, so we're agreeing that it's going to come to scrutiny at a future date. Yeah. So we'll now that the scrutiny has agreed that it will come to this committee, then we'll look at it when the report is available. And I'll work with Dheeraj and the officers to make sure it comes to scrutiny as soon as possible. Yeah.
How long's that going to take? Because I thought this was vitally important. That's the way it came through on the committee, and it was on the other pages as well. So it's supposed to be fairly important.
Yeah, I mean, we'll add it to the forward work plan and also bring it forward to scrutiny as soon as possible. I don't know whether Dheeraj, you're able to give any indication as to how soon the report can be prepared.
Thank you, Chair, Sir, and Councillor Keynes. We'll have a discussion at follow-up pre-meet to look at the detail requested by scrutiny. If it's a straightforward review of what's gone to our committee, I think that's fairly straightforward. However, if further information and details required, might take a little bit of time for officers to gather the information. I can't imagine it'll take too long. So at the next pre-meet, very happy to get that agendaed in with yourself.
Thank you. And yeah, certainly if committee members want to know sort of, after this meeting and before the next meeting when it's going to become, I can inform members or arrange to inform members that
I retire in 2 years. Well, shall we have?
Oh, I think you'll be safe to see it then. Okay. So moving on to the next item of the agenda, which is the chair's update. I'd just like to start by welcoming our new member, Taslim Aslam, who's a parent governor representative and was appointed on the 16th of December 2024. So welcome. We look forward to your contributions. With regards to an item that was just raised at the last meeting, this is the changes to the transport policies and the consultation about that. The timeline that was previously communicated is unfortunately going to have to move out slightly because the consultation documents are not quite ready. So the previously scheduled additional meeting that was going to be planned to take place on the 12th of March is unfortunately going to have to move back. Provisionally, the date that's been given is the 26th of March 2025 at 6:45 p.m. This is sort of fresh hot off the press. It only came up today. So again, I think I just need to check that date is okay, and before we commit, and perhaps again communicate with members on that before the next meeting once that's all finalised. Yeah. We've already covered the apologies for absence. Okay. Yeah. And just to mention again, just for information that we've got Alan Caton online. Is Alan? Oh yeah, I can see Alan there. Yeah, who's going to be covering item 7. Okay. Moving on to the next item of the agenda, which is item 7. It's the Luton Safeguarding Children Partnership Yearly Report for 2023 to 24. That is on pages 14 to 88 of your agenda pack, and is in the hands of Alan Caton. Thank you, Alan.
Thank you, Chair. I'm just very conscious to mention that this is a report that is now from the Safeguarding Partners, which is basically the local authority, the police and the Integrated Care Board. My role is that of independent scrutineer. So I'll just talk a little bit about my role in the scrutiny process. My thanks certainly have to go to Bev McConnell, who's with us on the line. Bev pulls together all of this work, and I'm sure members will agree that this is a very detailed and thorough report, which goes into some considerable detail about the effectiveness of safeguarding across Luton, and tells a really pretty good story about how the partnership works well together to safeguard and promote the welfare of children across Luton. So, and I do know if there are any, I'm sure he won't mind me mentioning this, but I did see Diraj in the room earlier, and I'm sure he won't mind me mentioning that if there's any sort of questions coming afterwards as a delegated safeguarding partner, he will be there to sort of assist me in answering any queries anybody may have. Like I said, Chair, I mean, I won't go through the whole report, obviously, because it's very lengthy and very detailed. I'll just cover a few issues from my perspective, and perhaps ask Diraj at the end of that if there's any particular issues that he wants to highlight, as he's now effectively the partnership chair. But like I say, my role is that of independent scrutineer. It came into force with the new multi-agency safeguarding arrangements, which was only published in last month in December. The chairing role, which I used to do, is now covered by the delegated safeguarding partners, of which Diraj has now taken on that role. My role is really to sort of oversee the arrangements and provide assurance for the fact that the arrangements are working effectively for children and families. I should sort of look at and consider how we are learning from our child safeguarding practice reviews, and perhaps talk a bit about that later, national reviews and thematic reports. So, you know, it's basically my role is to be that constructive, critical friend in the safeguarding system to oversee sort of that effectiveness. What I would say is I think that there has been a really good partnership developed across Luton. It continues to develop over the last few years, working with police, with health, with the local authority, with the voluntary sector, with probation. I mean, because safeguarding is everybody's business, and it's really important that we have a system where all of those key partners can work together effectively to promote the welfare of children and safeguard those who need help at a most difficult time. I would say that the Luton safeguarding arrangements meet with their statutory responsibilities. The new arrangements have been published. They should have been published on December the 20th last year, and that all has to go off to the Department for Education and go on the website, etc., etc. So that's all been done. And like I say, really good relationships, I think, have been built up, and there's the makings of a really mature partnership across Luton now, which does create that ethos of trying to identify its most vulnerable children and provide them with the best possible services. One area that I keep mentioning, and I have always mentioned wherever I've been working, is the level of funding for safeguarding arrangements. The guidance from government basically suggests that the funding for the arrangements, which should look at, you know, business units and analytical support and managing case reviews, you know, there's a cost to all of that, and that cost should be split between the three statutory partners. They talk about it in working together as being an equitable split. It's fair to say that it's not that across Luton. It falls disproportionately on the local authority, and my view is that needs to be reviewed, and that the lead safeguarding partners need to come together and make sure that they're comfortable with the level of funding for the safeguarding arrangements as we go forward. And I know there are discussions in place around that, but I do think it does fall disproportionately on the local authority, and we need to move on from that. Other things to mention, I think it's really important that we focus on the voice of children within the safeguarding partnership. We do make sure that they're involved in decision making, and we make sure we hear their voices, and we want to make sure that their voices are heard when we deliver services. And that's true across the partnership, you know, not just in the local authority and children's services, but within health and within police. And we seek assurance from partners that they are seeking the voices of children and young people. I guess areas that sort of cause me a bit of concern is the volume of neglect cases across Luton. The numbers of neglect are very high. To be fair, they are high everywhere, and it's predominantly the main reason children are on a child protection plan. But we really do need to sort of, I think, improve across the partnership our response to neglect and understand neglect in a much better way. Identifying and dealing with neglect at the earliest stage probably would help us prevent things escalating to more serious matters going forward. We do use a child neglect assessment tool called Graded Care Profile, which I think I may have mentioned here before. Well, I know I have, because I think I've mentioned it in previous years that we don't do very well with our use of Graded Care Profile. There's been a lot of work in the last year to improve that, and I think things are improving, but it's something I will continue to monitor to make sure that we do see increases in completing those forms so that we can identify children at the earliest opportunity. Learning from case reviews. I spoke about case reviews right at the beginning, and that's one of my roles, to oversee the assurance of case reviews. Case reviews take place when a child has either died or has been seriously harmed, and abuse or neglect is known or suspected in the case. And we do have a number of case reviews across Luton, and it's really important that we do learn from those. And I suppose, you know, we need to be better at implementing the learning earlier and making sure that learning is spread across the partnership and it's embedded into frontline practice. And again, that's one of my roles, to scrutinise partner agencies to ensure that recommendations and lessons learned from those reviews are embedded. One particular case that we looked at, which wasn't actually a Luton case, it was a Bedford Borough case, but we need to learn from each other, was a case of an adult review, actually. It was entitled Max, and it was about an 18-year-old who had transitioned from children's services to adult services and moved between areas across Bedfordshire. And that really highlighted, that case, the issues with transition of young people who are held within children's services but then transition as an adult once they reach 18. Particularly concerning are those children who are in the exploitation space, and there's a real danger that some of them can fall off a cliff edge with services. So we need to be better at the transitional safeguarding, and need to work better with you know, adults and children's services working closer together to improve the way some of our most vulnerable children transition from childhood into adulthood. But that's ongoing work that we're looking at within the partnership, and you know, you'll be pleased to know there's a group of really professional people across the partnership who view and oversee the provision of child safeguarding practice reviews, and there is a real sense of wanting to learn from those. I don't find a defensiveness across any agency, but I really do find a desire to improve the way services are delivered to prevent reoccurrences or similar themes. I suppose it's worth saying that attendance across all the partnership meetings from a wide range of partners is good. And, you know, I want to thank all of the partners for the work that they do across Luton to improve the lives of children and families. So that, Chair, is just a sort of very brief snapshot from my perspective as the independent scrutineer. Clearly, there's always work to do within children's services and within safeguarding some of our most vulnerable children and families, and that is across that whole partnership. But I thought I'd come back to you and see whether Tirridge wanted to add anything as the partnership chair, and then open it up further for questions, Chair.
Yeah, thank you, Alan. Tirridge, do you have anything you want to add at this stage?
Thank you, Chair, and Alan, good to see you again, and thank you for your presentation of the report. I've just jotted down a few things, but I just want to start with an acknowledgement. So Alan's been in the role of the independent chair, which then became the independent scrutineer, for several years now in Luton. And I know that Alan's written to the leader of the council to inform them that he intends to retire later this year. And actually, this will be the last time you present this report here, Alan. Yes, so just wanted to acknowledge and say thank you for all the work you've put in over the years and the difference you've made, not only for the children and families of Luton, but actually to strengthen the partnerships. And when I came into Luton Borough Council just over a year and a half ago, I could absolutely see the benefits of the work you've done. And it's made my job as taking over as chair of the Safeguarding Partnership all the more easier. So thank you for all the work you've done. And just to add, as Alan's already said, this report covers the period 23-24. 24-25 has been a crucial year for us to implement the changes that Working Together 2023 requires all local authorities to do. So as Alan's already stated, I take over as the designated safeguarding professional and the chair of the Safeguarding Partnership. And Working Together recommended a lead safeguarding professional for each local area, local authority. In Luton, we've decided that that role falls with the Chief Executive, Robin Porter, and therefore Robin now on a 3-yearly basis oversees the wider safeguarding assurance arrangements for us and the partnership. I think this is going to be a really interesting year as we head towards some of the more important discussions about changing our approach to children's services practice across the partnership, with a clear focus on early intervention and prevention. And Alan's right when he raises the issue about neglect for Luton and for most local authorities being a significant area of concern, which covers so many different reasons why children become neglected through parental attributes and family challenges. And in the report, Bev has captured, and Alan's talked in the exec summary about our approach to family help, and how family help is a partnership approach to ensuring that we intervene early and provide help and support to children and families across Luton. So I'm excited, and in the follow-up yearly report, we'll be able to talk a little bit more about the impact of some of those changes and the implications, including the future arrangements for funding across the partnership as well.
Thank you, Dheeraj. You actually touched on a question that I was going to raise. I've got a couple of questions before I open it up to the floor. You mentioned there's a number of causes for neglect. I was just wondering whether, with the data that we have, whether we can pinpoint any trends in terms of causes, you know, for example, I don't know, insecure housing situations, cost of living, and also of I guess, children who are families who are falling into that gap between qualifying support and not qualifying for support, and whether they're as a result falling into you know, challenging situations that perhaps ultimately leads to neglect.
So the category of neglect under the child protection arrangements is the definition of it is around significant harm, often at the point when a child is identified as being neglected and on a child protection plan for that reason. For instance, actually the rationale for that is that they have suffered or likely to suffer ongoing significant harm. And there are many factors that influence a social worker's decision and a child protection chair's decision, which could absolutely be covered and would be captured within assessments. Whether we can report and pinpoint specific trends of neglect would be difficult, but I would probably suggest that it's not just one area or two areas. It's a multitude of issues and challenges that families face that contribute to not only the drip, but rising issues of neglect for children.
Yeah, thank you. Before I ask my next question, I'll open it up to the floor. So, Councillor Mahmood, let's say.
Can I ask you, in terms of the report is fine in terms of the agencies and the partnership within the agencies. My concern is recently what happened in the news. Until legislation changes on home education and what happened to Sarah Sharif, how can you assure us that we would have an assurance from you as a chair of safeguarding board that those children that are in Luton are safeguarded in terms of what has happened to that child? Because the government is thinking of changing the legislation. Until it does, we need to be mindful of it and how it can really, between yourself, you as a chair, and the the corporate director as well.
Was that one for me? I mean, I'm sure Dheeraj will have something to answer, but I'm not. Can you hear me okay? Because I'm certainly getting some noise on my computer that there's a bad connection here somewhere, but hopefully you can hear me okay. And I missed the beginning part of your question, but I think you're talking about what's in the news lately. You're talking particularly about the grooming and the sexual exploitation of young children that's been going on across the towns and cities. I just missed that first part.
No, I'm talking about the home education and what happened to the child. Yeah.
Elective home education.
Yes.
And the fact that they're going to be bringing in a register, which is long overdue, and the fact that, you know, we saw a child, I think, in the news that was sadly murdered, and home education came into that. We do talk about that, certainly in safeguarding partnership meetings, and certainly from my perspective, it's one that I've always been concerned about. I do recognise the right of parents to home educate children, and we must also recognise that the vast majority of children who are home educated are well educated at home and don't pose any risk to them at all. But there are a small number, and I must emphasise from my experience, it is a small number that sometimes do get neglected and are unknown from services, and they're the ones that we need to monitor. And I think creating a register that will enable the local authority to have more oversight of those children will certainly help, in my view, protect children going forward. And I think the legislation, to be honest, I think we've been waiting for some time, which will improve the oversight of some of our most vulnerable children. That's my view. I mean, Dheeraj may have a different view, but that's certainly from my perspective around elective home education, where I think we're beginning to go in the right direction.
Thank you, Alan. Dheeraj, you wanted to come in on that?
I completely agree with Alan's comments. But in addition, I would say Sarah Sharif was known to services. And I think that's a reality that all children's services staff, managers, leaders often stay awake about. Having said that, the opportunity we have to learn from Sarah's murder, but also the murder of other children who are electively home educated, is now. So we, as a department, have already begun to look at our current arrangements for electively home education, our children that are electively home educated. There are some limitations around legislation. However, we want to look beyond that and see what's in the art of the possible for us and start to give it some added oversight and assurance. So watch this space. There's further work to be done and for it to be brought back, and hopefully in time for the next annual report, which we'll be able to report slightly, at least some part of the updates of our working to.
Yeah, the reason I'm saying that, and I probably was not speaking very loud and you didn't hear me, because every time we have an incident as serious as that, I've heard this so many years, lessons have been learned. A similar thing happened in Luton with a serious case review, and those parents are still in prison, a 6-month-old baby. And the number of agencies that knew, and the 3 local authorities knew. So it was not a hidden case. It was a case that where everything that we said had been learned, and a similar thing happened 18 months down the line. So the report is fine. It's very, partnership is working. My concern is where the one partner does not share the information with the other agencies, and that's where things go wrong. So have we really, are we assured that we got the system where we're all sharing the information with each other so the child is protected at all times? This is what my concern.
Can I come back on that, Chair?
Yes, Alan, if you'd like to, and then I'll call Dheeraj in. Yeah.
No, we have these discussions regularly, and you're absolutely right. I mean, it concerns me immensely that we're still, we still show most of our case reviews that there's, some communication error. There's information that's not shared that should be being shared, and it's a real frustration to me that still happens. That there's been a lot of push from government. They've produced documents. They've tried to bust myths around information sharing, because I still think there's still people are caught up and thinking that if they share information and it's wrong, they're going to end up going to prison or whatever it might be in agencies. Now, that nothing can be further from the truth. I mean, if people are sharing information about the concerns they have for a child, they need to do that, and we need to make people feel free to share that information, because that is often where it breaks down. And most case reviews will at some point tell you that information sharing has been a failure in that case, as well as lots of other issues. But we must also remember that safeguarding is a very complex area. There's lots of facets to that. It's becoming more complex as we go forward, with lots of issues affecting families and children as they grow up, and lots of agencies dealing with them, and having a system that actually will help information sharing is something that people like me have been calling for many years. And in fact, I was working with partners on a system called Contact Point back in about 2000 and I don't know, well, I can't remember when it was, others might know, but 2007 or 8. And then a new government came in and actually pulled the plug on that, which was going to be a national information sharing system for children, vulnerable children. There's a next move happening, which is going to create a unique identifying number for all children nationally, which I think will be the NHS number, and the government are going to legislate using that. So there are things in being which recognise that this is an ongoing, challenging problem, but there are things being put in place that will hopefully improve that, and we'll see improvements going forward. Thanks, Chair.
Thank you. Dheeraj, do you want to come into that?
I think Alan's probably covered a lot of the things that I was going to say, but I would probably also just finish with adding that, and this by no means undermines the challenge you've put to us, Councillor, and this is a challenge that gets put to us all the time, not just as local authorities, but across the partnership. In Luton, I think we receive something in the region of 3,000 to 4,000 contacts each month raising concerns for a child. And that should give you a sense of the sheer volume of concerns that we deal with. And in vast majority, actually, the outcome is that we respond, we share information, and we react in a timely way to safeguard children. Even one life is a very precious life, so we have to keep working hard to make it better.
Thank you. You have a follow-up? Yep.
Other thing that I would ask you in terms of child poverty in Luton is greater than other parts of the country, which does have a pressure where parents are working 2 jobs at a time, and sometimes children are not deliberately neglected but left on their own many a times. And those are the serious concerns we need to be, and the homelessness is increased in Luton far above. I mean, 650 families come in a month in Luton, and that going into a very temporary in hotels and that. So these are some of the serious concerns that members would have, and we should be taking that into serious concern, where there is not as much contact even with the schools or other agencies. So I think that those are the ones that probably ought to be, probably not in this report, but ought to be taken serious.
Councillor Ali, did you want
To go back on what he's been saying, thanks. Your questions are really, really important. It's the sort of stuff that Dheeraj and I have been talking about, and I've actually spent the day with the MASH and sort of going through the referral of when a person is or identified as being at risk, and some of the stuff around the family help stuff where we're changing the way that we do social care and having sort of coffee mornings and things like that, where families come to us, and it's more of the preventative strategy. So we're not just firefighting when children come to care and someone's been abused or someone's in hospital. We're preventing it by helping parents with poverty, neglect, if they're struggling with financial problems. There's a single hub, and we're only trialing it in the north now, but obviously it will be expanded, but where people can come over and talk to us about things like financial problems, they don't have a bed to sleep on and things like that. And that can add to preventing the more serious things happening. So that change is happening. I think it was a long time coming, and it's happening and it's working. And obviously it's a pilot, so we're exploring it more, but that's a really good opportunity to do it that way. And the other thing you said about data sharing is that's so incredibly important. And I saw this morning how the multi-agency safeguarding team work and how they do interact with the police and the ICB, but there will be times where things are missed, and if there's a more efficient way to do it. And I know that in the police they are exploring a project which might be a long time coming, but in terms of using AI to help with that data rather than everyone having access to everyone's systems, what we can do on top of all of that, it's probably going to cost a lot of money and take a lot of time, but it's the sort of things that they're exploring. So it's definitely on our radar.
Thank you. So we'll go over to Councillor Bickham and then over to you.
Thank you, Chair. Firstly, thank you very much for this report and congratulations on your retirement. First question is on page 67 of the pack, but 48 of your report. At the bottom where you've got the child death review overview panel, it says under the data quality that basically we are not recording sort of children's ethnicities, and in terms of ethnic measures we don't really have much to go by. It says that there isn't any reports on the deprivation quantiles either for those children who have obviously lost their lives. Why is it that we're still quite behind on this sort of data? Because it is quite important. It helps us build a picture of what's going on. So that's my first question. I'll let you answer that before I ask you another question.
If that was, I mean, interestingly, CDOP, whilst we put a mention of it in the report, and I might come back to Bev, it doesn't really sit within the safeguarding partnership now. It's the responsibility of the local authority and the and public health, and or the sort of health and the local authority and the ICB. I think, but it sits with public health and the ICB. And I agree with you. I mean, we need to get that data and we need to make sure that's right. But I might be able to bring Bev in at this point, because Bev will have put this together, and Bev might, and I know Bev goes to some of those meetings. She's got her hand up anyway. So if it's all right, Chair, I'll pass over to Bev to talk to that point.
Yeah, certainly can go over to Bev.
Yes, thank you. Just to say that the reason why we have the CDOP information in there is because as a Safeguarding Children partnership, we are separate arrangements, but we also scrutinise and hold them to account. So the reason why it's in our yearly report is because there are aspects that we asked CDOP about. We do know that they are utilising eCDOP better, and the plan, which should come in their annual report, which is going to be presented to our next Safeguarding Children partnership, and they've got a slightly different timetable to ours to producing them, but the eCDOP, which is an electronic mechanism of recording all those factors, that there has been updates and upgrades to the system to try and ensure that every child who unfortunately passes away and is subject to a child death overview panel does record that key data about who they were, their ethnicity, any issues of deprivation. Now, while they may not have all that key data currently, what they will have is modifiable factors. So if there were any modifiable factors around such issues, they will have collected that data. And there is a huge repository of CDOP data. And I can share the link to that if councillors would want to see that other data, and also share the link to the CDOP report when it is finally produced. But we thought it was important to improve that, to include that in our yearly report to show that we are scrutinising, we are interested, we ask challenging questions, and we always want to learn from children's deaths, regardless of whether it's due to natural causes or other reasons.
Thank you. And just to add to that, I think we've got in our next meeting, we've got the child death overview panel annual report coming to committee. Elizabeth, do you want to come in on that?
Thank you, Chair. And just introduce myself. My name is Elizabeth Elliott. I'm acting Director of Public Health, and I also will be taking on chair of the CDOP from next month. So just to I want to reassure you, I haven't read this report, but going forward, and the annual report that is going to come forward does absolutely 100% does now include ethnicity, and I'm also pretty sure it includes deprivation. So when it comes to the next meeting, we'll be able to present to you and share that report with you. The outcomes, absolutely, the modifiable factors are the key piece that we look at, but obviously we can link them back to all the other factors that affect a child. So yeah, it is separate to safeguarding, but we'll be talking about it at the next meeting.
Perfect, thank you. I think the answers that have been provided is actually it consolidates what we've been saying so far, what Councillor Hussein's been saying in terms of transparency, information sharing, and making sure that that information is shared across the different agencies, because obviously every department has multiple other subsections, and it kind of reiterates what even what Victoria Klimbey's death highlighted, the fact that people work in silos, and it seems that we still haven't mastered how to break those silos as yet. But it's good news to hear that that is one of the things that you're working on. And yes, Beverly, if we could have the links to those reports and when they are ready to come out to us, that would be great. That'd be helpful. Thank you. My next couple of questions, and I'm going to ask it all together because I'm going to forget. So this is where my dyslexic brain is going at 100 miles an hour. So first question, or second question, on page 83 of the paper report, but 65 of the digital report, where it says at the bottom of the last bullet point about all cases being graded. Now, this is something that actually one of the trainings, do you remember last year you had like a conferencey training type of thing for the social workers, where social workers were broken up into the different rooms? One of the things that became apparent, because I was invited to one of those by one of the officers, one thing that did come apparent is that every social worker has their own interpretation of how to do certain things. This concerns me a little bit, where he says that all cases graded as requiring improvement or inadequate, that you're going to be using like a SMART plan to kind of help you grade that again. Have you got a good, robust framework that social workers or whoever's doing the grading will work against? Because otherwise it is open to interpretation. What I might consider to be adequate may not be so adequate for somebody else. So again, just so that we are really tight with the safeguarding. So that's the first question, but I'm going to ask my others because I'm going to forget. Sorry. On page 49 of your report, no, sorry, this isn't actually relating to the report. It's something that you said in terms of the prevention, about the hubs and the way that things are going to be developing in the future. Question, I guess, to Dheeraj and Umi is going to be, when you have these families coming through the door, you want to do all this early prevention, which is brilliant. First of all, are you able to address the language barriers? Probably the answer will be yes, but what is the process after that? Are we referring them to further services? Do they have the means to access those services? Are they going to be able to access those services? And what is that going to look like? Or is there going to be some support? Because we might send somebody away and say, okay, you can get beds from blah, 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 blah. Here's a voucher, off you go. What if they don't know how to do it or don't know where to go? Or if it's a single parent and can't physically go or what have you, how are we supporting them through that process? The other thing was to the gentleman online, forgot his name already, sorry. When you talked about NHS numbers, of course, NHS number is unique to each individual. However, hospital numbers differ. Again, how is that transfer of information going to take place? How do you kind of connect the dots? Because we could easily perhaps miss a case or overlook a case if the numbers do not match up. So if you're given somebody's NHS number, that is their their generic GP number, whereas it's different to a hospital number. Again, how is that going to transfer over? So that's all my questions. I've asked everything. Now I can breathe, and I'll let you guys answer. Thank you.
Dheeraj, do you want to take that one?
Can I just start? Can I say that I'll ask Sancha to pick up the first question? I can pick up the second, and if I can invite Alan to come back for the third, if that's okay.
Good evening. My name is Sancha Thomas. I'm head of QA for Children's Services. So the point that you raised with regards to grading and our grading system that we have, it is in line with the Ofsted grading. So inadequate, requires improvement, good, and outstanding. Now, as you would imagine, the local authority has a robust QA framework. We've just revised that, and that outlines what good looks like. So when you say there's different interpretations of our staff, we've done a lot of work with our staff in terms of what we see as good, and what, you know, we are looking for in each category. So if a case is deemed inadequate, these are the reasons why. Same as requires improvement, good and outstanding. As you are aware, we're on an improvement journey. We are in a Ofsted window, so we are doing further work in ensuring that any case that's inadequate requires improvement. There is a robust SMART plan, as you say, but it's a robust plan to improve practice, to address the issues, and that case is re-audited to ensure that we have progress. And those issues are raised with the head of service and our directors, and we do have an audit report that outlines, you know, our performance in those areas and the themes that come from our audits. So I hope that gives you reassurance in terms of the planning and the framework we have around our audit process.
Thank you. Dheeraj? Thanks,
Sancha. In relation to families who access our help and support, so often if a family has exhausted all community resolutions and they require access of a family help service, they have met a criteria and a threshold for intervention and support. And often that means that there's an ongoing assessment and a plan in place. So if we are then signposting them to other services, it would be the member of staff, the family help lead practitioner, the social worker, the family support worker, who would then follow that through to make sure that services are then providing the service that those families need. If not, where else this might be able to be available from. But actually, we also need to make sure that families are empowered as far as possible to seek help themselves, because actually we want them to be resilient and we want them to be able to safely manage their needs in their communities as well. And then I think
as well, I think it's also just within a pilot and we're starting, so there will be things where we'll identify that we need to do more on. But when I was talking to the team manager about this specifically, actually what you raised, and the cultural barriers, we made it clear that just translation is not enough. You need to be culturally aware, because you can get a translator on language line and put them on the phone, but it doesn't mean that you're understanding what's actually going on in their lives. So they have a good understanding of that, and everything is not perfect, but as time goes on and as it expands, it will be things that we work on. So we welcome this sort of questions and feedback.
Alan, do you want to come in on?
Just to come in on the unique identifying number, I mean, it's still early days. It's just been put out by government in a report that they're going to legislate for. I mean, it's something that agencies have wanted, so this consistent approach to information sharing, so we know we're talking about the right child at the right place. I guess I'm guessing, and I'm sure health colleagues in the room will let you know, every child that's born gets a unique identification number, and that tracks them through the health system. Don't know about hospital numbers, it's totally different, but there is one specific unique number that the government are saying that should be used as being the consistent method of identifying children and for sharing of information, and that's just come out. They're going to be legislating for that, and more detail will come out in due course. And obviously, as a safeguarding partnership, we want to make sure we put in process, policies and procedures that make sure that works effectively for us. So we'll just continue to watch that space and make sure it works for us and that it works across the services that we work with. Thank you.
Thank you. We have a question from Ashish.
Yeah, thank you very much. So again, fantastic report and really well done to everybody involved. And it's really pleasing to see the voice of the child, voice of the children being prioritised, and then also praised by Alan, the scrutineer, in this. So my question relates to Councillor Hussein's comments and questions, and it's specifically on page 87 of the group pack, but page 69 of the report. There's a reference with regards to the learning of the reviews and then the audits as well. I hope I've got that paper right now, so I've been flicking in between. And so what I'm really interested in is, what is the timescales for implementing the learning of those reviews and the audits? And I know that can be a particularly open question. And so then I'm really kind of interested in, this report was from 23-24. So in your experience, either Alan or Dheeraj, how far have we progressed against that action, in particular the learning? So, is there still something left to do? I know I'm putting you on the spot there, so forgive me. But if you can answer that, that'd be really helpful. Thank you.
No, that's a really, really relevant question. I suppose I would point out that we don't wait and don't adhere to sort of timelines, as it were, because once a case has happened, we will go into what we call a rapid review. So we will call all agencies in within 15 days of it coming to our notice. So all agencies will get the detail of the individual concern and come together, and I chair those meetings, and we'll talk about the issues that perhaps caused the serious harm or would have sadly caused the death, and what do we know about that now, and what can we learn from it. So, sometimes we implement learning from that meeting onwards. We don't wait for a formal review. Bev does all the work as the business manager. She will, as the review then gets completed over a period of time, and reviews have to be done within a 6-month time frame. That's not the time frame we look at for embedding the actions, because as soon as we get an action and we think there's learning, we'll try and move that forward. But Bev will be responsible within the safeguarding unit for developing an action plan that stems from those recommendations, and then we will monitor those. Some of those actions can be implemented quite quickly, and obviously some might take a longer period of time to do. And yet, you're hearing today, aren't we? It's in the national news, the recommendations that came out from the independent inquiry for child sexual abuse. And actually, why haven't we implemented those 20 actions? And a lot of those were for central government to do, and they're now looking at that at pace. But it's a sort of similar thing, but on a local level. We do want to ensure that actions are embedded into practice. We hold agencies to account once the report is written and the recommendations are put forward, to agree those recommendations and to agree the actions. And then we hold agencies to account to come back and update those action plans. And there's something else for me as the scrutineer to go back perhaps a year or two later to really assure ourselves that actually what we said a year ago to prevent further incidents happening are going to be in place in services that's now working effectively, that will hopefully improve outcomes for our most vulnerable children. So there's no sort of one answer that they'll all be done within a certain period of time. So we start immediately, we don't wait, and then we take time to make sure we monitor it. There's good governance. All the action plans are monitored, they're updated, and they're filed accordingly, and we note when they're completed or not completed, and we hold agencies to account if they're not. I hope that answers your question.
Yes, it does. That's really reassuring. Thank you so much.
Thank you. Councillor Keynes.
Right, I've ploughed through this report, and I may have missed it, and I apologise if I have, but there doesn't been much mentioned about child suicide rate, which I believe is on the increase, and it's totally different to normal abuse death.
Certainly, I know, and I saw Elizabeth was in there, and she's going to take over the. I mean, the child death overview panel will certainly be monitoring all deaths of all children. Like I said, this report, from a safeguarding perspective, will look at case reviews where children die and abuse or neglect is suspected, and in some cases, clearly, children commit suicide, or shouldn't say commit suicide. Children take their own lives. And abuse or neglect is not necessarily suspected in that case. There may be mental health issues or something else going on, but so it wouldn't necessarily be reflected. But we do take seriously those, and we do, as Bev has highlighted, look at those deaths that occur. And I think I'm right in saying, Elizabeth, when I've read the CDOT report, that they do highlight the cases of suicide, so that is monitored within CDOT. But I'm sure Bev's got a hand up again, and like I say, she sits at those meetings and probably would have greater detail than me.
Yeah, I'll let Elizabeth come back if it's about CDOT particularly. But in relation to this report, yes, we have covered off our learning around suicide and looking at suicide prevention. We did publish a review for Child V, which was a child who sadly took her own life. And as well as the work that we've done in 23-24, as Alan outlined, we've done a revisit of that and looked at it in terms of also some national learning as well that had come through about deaths within acute mental health units, which were tier 4 beds. We also have an annual update that comes through public health around suicide prevention. And when we have these themed reports, one of the things we do is we ask, what is it that we know about the theme? What are we currently doing? And what more can we do? And we look at it very much from an evidence of impact base. So I think, off the top of my head, I think there's about 9 different references in there, but they are scattered through the report. But there is a section, I think, around about page 32-ish, which is around emotional health and well-being. So you might find more of what you're looking for there.
Thank you. Liz, do you want to come in?
Yes, happy to. So thank you for your question, Councillor Keynes. And again, to my previous points around CDOP, that CDOP obviously looks into any death of any child under the age of 18. I can assure, and when the CDOP report comes around, you will see that we do have very small numbers of children of that age who do take their own lives, and we do look at that through CDOP, and we will look at modifiable factors and learning from that. So be reassured that although it might not be in detail in this report, in the CDOP annual report, it will be in there. Numbers are thankfully, as I say, incredibly low. So from that perspective, it's not something that we are seeing an increase on around children. However, we obviously take any of those cases and we look at them as part of that process. So there'll be an opportunity to look at that when we bring that report.
Thank you. Just to add again, as I mentioned earlier, that's coming to the committee in the next meeting.
That's good. Thank you. But I do say if it's low, it shouldn't be at all. And we've really got to keep an eye on this, because I do remember a child taking her own life at the school I was a governor at, and it affected everybody from top to bottom.
Thank you. Councillor Hussain? Yeah.
Yeah, it's probably not in this report, but it's just recently in the press, the number child abuse, particularly in terms of bullying and sexual abuse, is on the increased. Larger number is that, and that's not in this report, and I think it ought to be taken into in terms of safeguarding of children.
Yeah, certainly. Anybody want to take?
I mean, I would certainly not disagree. It concerns me, this sort of low-level bullying. I'm concerned about sort of, if you like, sexism, rape culture in schools. Sexism in schools. Young girls are experiencing, terrible sexism. There's a sort of culture of rape fed by young boys accessing hardcore pornography on the internet, and the Children's Commissioner did a report a few years ago basically saying that 100% of young boys are experiencing or viewing indecent images or pornographic images online. That reflects then on the way they treat girls in schools. So I think there's a lot of work we need to do in schools and sort of educate our boys about how to behave effectively, because sadly so many girls and young women, and we hear the male violence against women and girls is significant, and we all have a responsibility to look at that as well. But I think it starts with the bullying and the sexism and the cultures that develop in schools, and people like Andrew Tate, who these young boys who follow and have a big online presence. We really do need to sort of do some work combating that. And I do know there's a lot of work going on in schools to try and combat some of that behaviour, but it does, I think, doesn't bode well for our girls in school at the moment. From what I hear about the way that they're experiencing sort of sexism and those sorts of things in school life. So we continually need to look at that and ensure that schools are doing what they can. And we do get good buy-in from education, and we do get told, but it's acknowledged that is a problem, and that all schools across the country are experiencing that, and that's something that we need to look at and continue to look at.
Thank you, Alan. It's an important subject, and I've allowed an hour for it, but I think we probably need to move on. So thank you, Alan, for the report, and again, congratulations on your upcoming retirement.
Thank you.
If we move on to, if we may, the next item of the agenda, which is item 8. It's the Oral Health and Dental Access Report, which is on pages 89 to 108 of your agenda pack. And I think is that with Liz? Or, oh, sorry. Yeah, okay.
I'm happy to introduce it, but I'm going to hand over to Neela. So yeah, I'm just going to introduce Neela and Michelle, who are part of our Healthy Lives team leading on dental access. And we've got Nikki and Jason as well from the ICB also to talk about dental access.
Thank you, Elizabeth. Good evening, everybody. So I wanted just to bring a quick update on the things that we in public health have been doing. I'll make an assumption you've looked at the report already. So just a few highlights. We have been working really hard at our oral health promotion still. We're continuing to share key messages across Luton. We've been taking a MEC approach and making sure that the workforce who engage with other families all around Luton are being trained. And we've had 66 members attend our training courses, and we had 3 sessions. So really good uptake there. Our oral health resources, again, we've made sure there's accessibility for our families. We now have our Family Hubs website, which we have a page dedicated to oral health at different stages. We were working in collaboration with Barnfield College. We made an under 5s health promotion video, so how parents of children under 5 can help look after their children's teeth, just recognising how important it is for those early days to get it correct. We've got additional resources, sorts Padlets and things that they can download and access. Our supervised toothbrushing has been a real hit. We work with Dental Wellness Trust. They've been commissioned for the last 2 years, and we have just secured another 2 years with them match funded, 120k the contract was, and they match funded it. So we've been able to do quite a significant amount of work with our schools and early year settings. So we've had a 55% increase. When I began a couple of years ago, we had 2 schools in Luton doing supervised toothbrushing. We now have 23 schools doing supervised toothbrushing and 16 early year settings, including 1 childminder. So that's been a big success. Lots of challenges in schools. Schools are under a lot of pressure. We have had a bit of fluctuation, schools dropping out, coming back in, but really proud to say that in every single ward in Luton, we've got a touch of something. We have Toothbrush Tuesday, get my teeth in for that one, to make sure that something's being done everywhere. So children who aren't able to brush their teeth every day through the supervised toothbrushing programme, we were donated 10,000 toothbrushes and toothpaste working with the Hygiene Bank, and we used it to create a project where you brush your teeth on a Tuesday at school, and then on the conversations and kind of weaving an understanding of what oral health is, the teachers would say, did you brush your teeth last night? Have you brushed your teeth this morning? And they will have a chart they're able to tick on their chart that they've done it. So it's only requiring the Tuesday for them to do it at school, but they are still having that underpinning knowledge and understanding of what it is to look after their oral health. And that's been a big success for the schools who are just not able to commit to everyday brushing. And yeah, as I said, really proud that we're in every ward there's something, either daily brushing or Toothbrush Tuesday. A really key highlight, again, we've got our Oral Health Alliance back. We've worked really hard to get good members around the table. We've got a really clear vision, a 4-pronged approach, looking at all aspects. I know dental access, which will be discussed, is a big thing, but also looking at actually understanding and having the parents and the teachers on board, promoting good oral health, looking at what children are eating and what they're drinking. That impacts oral health as well, and making sure that we are culturally sensitive to all the different communities in Luton. And I think you'll remember a few. I think not the couple of scrutinies we came back, the pop-up clinics, which were a really big success within Luton. So we've been working really hard just to keep going with that, and we're having we've made some ground in Luton around oral health that we're very proud of. And regards to dental access, I'll hand over to Jason and Nikki. Thank you.
Good evening, everyone. My name is Jason Ellis. I'm the Senior Contract and Development Lead for Bill & Kate ICB for Dental. So in terms of dental access, as Neela has said, we've started an expressions of interest for the pop-up clinics, and that expressions of interest finishes next week. To date, we've got about 6 applicants who bid for that. So we're excited and we're hopeful that we'll obviously be able to re-establish that scheme and help obviously children between the ages of 0 and 17 in terms of that oral health education. In terms of dental access as a whole, we are working extremely hard to obviously try and support our dental communities in terms of increasing that output. We are supporting through schemes like the Golden Hellos, which is the dental incentive recruitment scheme to try and support dentists to entice new dentists into the area. It is obviously a challenge because in terms of access, we can't deliver that obviously unless you've got the staffing capacity to do that. And that's obviously a national problem. And that stands at the moment. We have less graduates coming through the programmes nationally, and obviously that filters down to here regionally as well. But we are doing the best that we can do. I will say, as a good news story for Bilham K ICB, we've got about 4 whole-time equivalents in total that will be starting in terms of Luton. That means there's about 1 whole-time equivalent dentist, which will be 2 dentists that will be starting in this patch. We think it might be 3, but I'll manage that accordingly in terms of the expectations. How we reflect is that we are the only ICB in the country at the moment who's been able to start new dentists as part of this scheme. So we're obviously really pleased by that indeed. In terms of where we are in terms of children, we are on target at the moment to deliver around about 35,000 appointments, or at least unique children being seen, which is about a 6% increase on the year before. It's still obviously a challenge. The demand out there obviously exceeds the capacity that we have. And in terms of the budget that we have, it's still going to be ring-fenced, which I'm sure we'll discuss as part of any Q&A. But we are obviously doing the best that we can to increase the capacity to meet the need. In terms of current providers, we have in total about 21 practices within Luton, 16 doing general dentistry, and the rest are doing, 5 of them are doing orthodontistry. But again, we are working at full capacity. And in terms of the outcomes, we're expecting that most of our dentists in Luton will actually be achieving the contractual requirements by the end of this financial year, 31st of March 2025. Sorry, Nikki.
No, hi there. So I'm Nikki Pallone, I'm the Link Director for Luton, and I'm the Chief Primary Care Officer. So I just really want to pick up on the points that Nuala's made in particular, because it is about well-being. So, and I really like that focus on oral health, and it's all of our responsibilities. So if you look at the report about the decayed, missing or filled teeth, it is horrific. So there's a lot of practical stuff that we need to be doing together. So it really is us working together. And I know we've got the Luton Family Hubs we're doing. So for me, it's about the pharmacists. It's as well as working with the primary medical practices and obviously with all the networks. If you look at the numbers of children that are actually coming into hospital to have teeth removed, one horrendous waiting list, but the most awful. You then link, and if you look at the later report, it talks about, isn't it, 46% of children overweight by, in primary school. So all of this goes together. So we've really got to get that really holistic look at it. And that's where I think working with Diraj and working with Mark Fowler, etc., it's about that neighbourhood health. So we need to go with the facts. And I think we all need to be ambassadors of doing the right thing for our young people. Midwives should be interested in tooth health. And that's why I think it's trying to get that prevention. If you look at the latest government, it's about prevention. So technically, if we started doing the right things now, we shouldn't have any, under fives in that position. So I'm admiring the work we're doing, but we just need to do it pace and extending.
Can I just say as well, we are due a new dental epidemiology survey. They surveyed our under fives this year, so it's done every 2 years, so we should be due up-to-date data in the next couple of months. So we're hoping that we'll see a decrease in the DMFT on that, so be something to look forward to. So, and Nikki's point about that holistic approach, that is linked into our infant feeding strategy. So I'll tell you this in a minute when we talk about family hubs, about the increase in breastfeeding rates, but also the work we're doing around physical activity and kind of obesity and that. So we are linking in every aspect.
Great. Thank you. Councillor Begum, you had a question?
Yeah, just as you were talking, actually, I was kind of thinking of how we can increase that engagement with the schools and things like that. So schools, especially primary schools, tend to have their student council. My son being one of them, and he gets really excited. Oh, Mum, I'm doing this today. I'm doing that today. They came over to the council, got a goodie bag with some toothpaste and toothbrush and what have you. And I thought, have you thought about asking the schools if they could perhaps promote toothbrushing and all of that with their student councils? Because peer on peer takes the message a lot better than us as adults dictating to young people, do you want to do this? Because then it gives the student council a bit of power, in a sense that you've got a responsibility, and they feel quite excited about carrying out that responsibility, and they can relay that message with as much enthusiasm and passion to their peers to get that message across that actually, look, I had to have a feeling. It didn't feel very nice because my son has had feelings. He was almost very close to that hospital list. Thank God he's not. But it's like, you know, they can relate to each other a lot better than perhaps we can, and they engage a lot better with peers of their own age. And even the youngsters, like i.e. in sort of like the nurseries or sort of like reception year and so on, they would engage much better if they said, oh, we've got a guest speaker for you today, but they're only that big, so they're not too bigger than you, but they look at them as a sibling and as a role model. So have you thought about perhaps using those sorts of, because these infrastructure or these sort of councils and things like that, it's already in the school, it's just utilising what they already got rather than putting more pressure on teachers to kind of get the message across, things like that. Thank you.
No, thank you. No, definitely. We've done lots of work with schools. In my previous life, I was a teacher myself. So we have got a family workers network group that we run, and we do engage with them and look at things like school council, which are a great resource. The difficulty we have is that we need parental consent because there's fluoride in the toothpaste. So we have got that pester power of children. We have got children who can say, I didn't like that, I didn't want to have a fill-in, and so, you know, do this. But without the parental consent, children can't engage in the programme. We do audit yearly with Dental Wellness Trust, and we did go to a school, which was a really fantastic opportunity. And when they were brushing, the parents who hadn't consented, they still had a toothbrush, they still brushed, but there was no toothpaste on it. And what that did was that increased the number of parents who then went to sign, because the children went home and said, I'm doing it, but I'm not having any toothpaste. I want to do it. I want to do it. And then parents came and did it. So we have tried a few things. But there is a whole different discussion on fluoride. Some people don't want their children brushing with fluoride. We do need to have consent for that. So the children can only do so much. They can influence, but they can't have that power to do it. But I take your points. Good idea.
I mean, I find that surprising a little bit, because when we take our children to the dentist and they say to us, oh, you know, can we just put on some fluoride because your child needs it? Automatically, as a parent, even I do, I'll be like, yeah, definitely get in there. So that's a bit surprising. So maybe there is sort of like that fear that we need to perhaps break down with parents, because obviously there is a fear element that there's something else, a bit like the flu jab, that we don't want to consent our children to having the flu jab because we think there's something that isn't very sort of friendly, either culturally or religiously. So I think maybe, through perhaps, I don't know, coffee mornings and things like that, because schools do have a lot of coffee mornings.
So we do coffee mornings. We've been around to schools, and where we do talk to parents, and we do debunk the myths, because it is a real thing. People do listen. We've got 12 top tips that were developed way before my time that go out. We have got the Family Hub website. Engaging. I'm working with Barnfield College with some of the comms team. We're looking at potentially doing some interviewing to get some sort of key messages out. So there are things in the pipeline, because it is a barrier, not a huge barrier, but it is a barrier for some children, for some cultures, and just people have choices, don't they? So it's really difficult to push that on people. So, but no, I do take your point. Thank you.
Councillor Mahmood Hussain.
I mean, first of all, welcome, you know, in terms of increasing the number of schools to 23. My question really is in terms of the areas that have a larger deprivation, you know, in terms of the child poverty in 72%, do you sort of target those areas and particularly those schools so that, you know, those children really in terms of the parents, as I said before, on another thing, that who are probably doing 2 jobs, don't have time to sit there, making sure every child has cleaned their teeth. They're rushing out, getting them to school, and that's it. And that is the reality of life in some of the families. So is that a good thing that you do? And when can they really, access the dentist? One of the difficulties is accessing a dentist at all, because all they want to do is to do more private work than anything to do with the NHS.
No, absolutely. There was an oral health needs assessment completed in 2019, and it highlighted the wards where the highest prevalence of dental decay was. And when we did our pop-up clinics, we did target those areas. We had a universal offer for all reception children in all the schools when we first started. Where there was no uptake in some areas, we then went to the early years settings and childminders in those wards that we knew had the highest prevalence of tooth decay. So we have had a targeted approach, and our pop-ups were around those areas as well. So we have been doing that. And in regards to dentist appointments, I will hand over to Jason for you, because that is not within my remit.
That's what I thought you might do that. In terms of dental access, we are indeed trying to access, in particular, obviously, Luton, in terms of our BLMK. I'm sure you're all aware, in terms of our BLMK, Luton is probably the area of our greatest need, and so we are trying to target that. Again, it just comes back to the staff and being able to recruit staff to come into the area. What we are trying to do as well is better utilise our dental therapists and our dental nurses, so actually using the whole skill mix within a dental practice. So what you're trying to do then is tier it up, so your dentists are seeing those patients with greater need, and then you've got those more routine treatments, which then can be seen within the skill mix of a dental therapist and the dental nurse, to try and see obviously more patients coming through that door. But again, it does come back to demand, it comes back to staff, but we are, through the Golden Hello scheme, we are trying to target as much as we can do. And I neglected to say that in terms of our national target, we were targeted to do 5 whole-time equivalents, and we are about to break that. So once we can sign contracts, we'll be the first ICB to do that. My understanding is no one else has done that in the country. So we are doing our best, but we are also liaising with Health Education England about how we can attract more staff into this area, because obviously coming here, a lot of our staff mix comes actually from London, and so it's about trying to get our FDAs, our foundation dental kind of colleagues to come up. Some of them do, because I think London has become a little bit tighter, a bit packed, and so people do want to actually work outside of that. But unfortunately, they're kind of bypassing Luton, going up to Milton Keynes and things like that. So we are trying to obviously, create a better kind of atmosphere, or, trying to entice them to come to Luton, because I think in terms of developing their skills, there's no better place, to be honest. But we are doing the best that we can, Councillor.
Thank you. Ashish?
Sorry, just a quick one. Really good report. Thank you again. So I'm just interested from a school's perspective. So do schools have to buy in to this service? So it's all free, is it? Okay, so I was trying to think of the barriers from a school perspective as to why there would be a barrier in terms of the take up. I was looking at the wards and stuff. So
it's completely free. And I've done door knocking. We've tried everything. As I said, I think schools are faced with lots of difficulties at the moment. There is the big pressure. They've got the competing priorities around academic achievements, and they've got sort of what we've been looking at, our safeguarding, the well-being of children. It's humongous, and they're having staffing issues and recruitment. People leave teaching, like myself, and it's what's happening. So they're not able to commit to it, and it's a big commitment to them. But we are hoping the Toothbrush Tuesday will be more of an incentive. It's not so taxing on the teacher, and it's more conversational and embedding. And like Nikki was saying, if we all speak about it and make it all of our business, and we're doing all these things, and we're eating the right thing, brushing our teeth every day, using fluoride toothpaste, the dentist chair or waiting list for dentists will reduce. That by the time you get to the chair, you're at treatment stage. And actually, there's a lot more we could be doing to look after our children's teeth. So it's a difficult one.
It's very helpful. Sorry, Dheeraj, coming to you now then, really. So as a if I was a head teacher, I'm not clearly, but if I was a head teacher, am I getting inundated with all the contact points that are potentially coming through, and how often is communications coming to say, don't forget you've got these services? So for example, as a parent, I get at the very start of the academic year, if I can call it that, I get a list of all the dates for the year, and I make sure, try and put them in the diary, etc. And then I get these different messages throughout the year, and I naturally miss some. So I'm just trying to think from a head teacher's perspective. It might not be head teachers, it might be other colleagues. How can we reinforce the messages, but it's kind of a comprehensive message of all aspects? Because we talked about this being well-being, but we, in the earlier report, we talked about neglect, for example, and I'm not suggesting that there's a correlation, but I can't help but think anecdotally there must be some form of correlation as to this is the start of a slippery slope. So how can we start doing some of the preventative stuff that can really then, and it could be that toothbrushing is the start of that. Thank you. Sorry, Dinesh.
Thank you, Ashish. I think it's a really important question. We have a regular newsletter arrangement with heads and schools, and we often have all sorts of information, whether that's family hubs information, whether that's school attainment information, attendance, any updates to legislation, any opportunities to do things differently to improve the well-being and health of children and young people. Those go into those newsletters. That's on a monthly basis, if not fortnightly. I need to just double check that with the team. So there's opportunities for us to engage and have those conversations at a regular basis with schools. And actually, that's a really useful touch point for head teachers about any key areas of challenges, but also areas of focus that we think would be very useful for schools to be involved in. As I think the next paper talks about family hubs, I think it's worth mentioning the reach of family hubs in communities, the reach of family hubs across the neighbourhoods. I think these are really important touch points for schools and for the communities directly as well. But also the work that we're doing through, as Councillor Ali said earlier, about the family help hubs, slightly different to family hubs. The family help teams, again, based in the communities, based in the neighbourhoods, would enable us to have better communication with schools, where some of these issues can become general, everyday conversations, as Nikki was saying earlier as well, because I think that's what we need to do. Now, going to your second point about neglect and the correlation with dental hygiene, dental health, absolutely it's a concern. What we have to make sure is we don't conflate abuse and neglect with neglect as a result of some of the real challenges our families face. And that's where help and support is really important. Education is really important. Getting them back on the track is really important.
Any other questions, comments? No. Okay. I think it's just a case of noting the report. So thanks everyone for presenting the report and responding to the questions raised. Thank you. Okay, we will move on to the next item of the agenda. Where are you? Item 9, which is the Family Hubs Impact Report, which is on pages 109 to 130 of your agenda packs. And that's with Michelle Bailey and Elizabeth Elliott. Thank you.
Hi, good evening, members. I'm Michelle Bailey, Public Health Principal. We came a while ago to Scrutiny and we've updated a couple of times actually on the progress of the family hubs. And one of the asks was to whether we could show the difference that we were making to our families and our children with the introduction of the hubs. So we've pulled together a Family Hub Impact Report, which you've hopefully all seen and read, to kind of reflect and look at the progress over the 2 years since we've had the funding and the impact that we've made on our children and families. So I just want to highlight a few areas. So firstly, the Department of Education are really pleased with our progress. They've said we're making exceptional progress. We've done a collaborative approach, working with our partners to develop our sort of family hub network, so working right across the different neighbourhoods that Diraj just sort of mentioned. We've introduced our website and app and we now have over 7,000 users, which is great, and that's available for everybody in Luton to use, whether you're family, child, professional, counsellor, or whatever. So I encourage you to download that app afterwards. We've got a Start for a Life offer and roadmap, which shows all the services and support available from conception to age 2. That's been translated into different languages. That's available as hard copy and as well as digital. And we've had it produced as posters that are in our maternity wards and our family hubs. And we've had really positive feedback from families. We've had families saying, oh, we've been waiting for this for quite a while. Had positive feedback from partners. It's a really good conversational piece, but also we went to Westminster to present our work in Luton, and the Children's Minister and Children's Commissioner really liked our kind of work, especially the fact that it was translated in different languages. So that just shows the support from for parents from conception and helps them to support their journey into parenthood. So Alan mentioned earlier about the increase in neglect cases. So early intervention is really key. So the support that we've been able to introduce with the family hubs around parenting programs and parent-infant relationship programs and interventions and just information and advice to support parents and families to make sure they get support early and help them become better parents, more resilient, more empowered, and know where they can go to get support early before they get cases of neglect or go into crisis. So you can see from the report that by introducing the family hubs and working, it's particularly with Flying Start around our 0 to 5s, we've extended our reach by 150% since 2021. Flying Start have seen nearly 17,000 attendances for their sort of services. So there is a massive need out there. We've introduced breastfeeding buddies and infant feeding support peer support workers. They work across the hospital and communities. So they are employed by Cambridge Community Service, but they're hosted in the hospital trust. We're one of the only areas to have that model, and we've seen an increase in breastfeeding rates to 89%. And that's had other impacts, and that really links help to our oral health prevention work as well. We've got speech and language therapists and practitioners. They've seen over 1,400 contacts. We've got a little talkers group, so to help with speech and language communication, because that was an area that was identified by the Department of Education, Department of Health and Social Care, obviously from COVID. There's lots of children that had speech and language delay, so we're getting that early intervention, and we're gradually seeing the expected levels of communication increase in our 2 to 2.5-year-olds and our end of reception. So that's really good, positive news. One of the areas that we have added since you've had this report is a section on volunteering and the dads group that that is run by Flying Start. And the volunteering really links into the Luton 2040 work. We are seeing parents and volunteers volunteering with us and then getting skills and experience and being able to go on and get employment, which is really, really good for the town. And then just really want to highlight a few things that we've got coming up this year. We've got some augmented communication boards. They're going to be in 6 parks across the town. So we're working with a company called Widget. So that's to help aid communication and language, not just in children, but in adults that are non-verbal as well. We have started a refurbishment of our central family hub in the downstairs of the central library where the children's library used to be. So that started last week. So that's really exciting. Hopefully it will be finished by April. And we're working really, really closely with Luton Access, Luton Supporting You. So that's a really joined up approach, and we'll be able to offer extended kind of reach into kind of our non-funded areas. So housing, family, food bank and citizens advice and domestic abuse and lots more work there. So I've added on a bit at the end actually, which I haven't included, and I need to add in about engaging with schools to get more schools on board to be part of our family hub network. So we've been really busy, but I just wanted to kind of highlight some of those key areas. So and one last thing, and I will be quiet. We've sent this off to kind of to be properly designed, because we think then we look a lot more professional. We'll be able to kind of share that wider, kind of locally and also nationally. So we'll be able to share that when that's all signed off. Yeah.
Thank you. Any questions, Councillor Keynes, and then we'll go to Councillor Singh.
I will have a moan as usual. We used to have a system in Luton when I first got elected of the children's centres. They were done away with by the Labour Party. So we're back to square one with the hubs. Sorry, but that's the truth. But I do notice from this very tiny map, there is no hub in Vauxhall Ward. Any reason why? I know, you've got to have good eyesight. Because of the hub, don't we?
The hubs are more than buildings. So we've got a hub, spoke and outreach model. And we did do away with the children's centres, but actually in hindsight, although that was really, really difficult for us, it's given us lots more opportunities and it's made our model quite unique, and we've been able to kind of extend our reach and actually take the services into communities where they're needed. So we do work out Vauxhall. We work really closely with St Francis Church. We've got a really good breastfeeding support group that runs out there, and Little Movers, and the parents and families are really sort of proactive. So there is lots going on in every neighbourhood of the town. And our website links it all together. So families can download the app whatever ward or neighbourhood they're in.
Right. The only problem with that is St Francis, yes, great, Vauxhall Park. Napier Park, which is a new development, you've got to go an awful long way to get to a family hub from Napier Park, which is Kimpton Road. I'm just wondering where it might be worth looking at somewhere down there.
Napier Park, you go to Parktown, which is not far. You just walk down Manor Road, and then you're in Bailey Street, where Parktown Family Hub is, or they'll be able to easily go into town to Central Library Family Hub. So, but we can start to work and see what. I don't think there are any sort of community groups in kind of that area, but there will be more and more services set up. We're starting to work more with voluntary organisations and faith settings as well. So there are new developments coming up all over, but we won't be able to have a physical building in every ward or every neighbourhood. It's just not sustainable. But Parktown will be the nearest for Napier Court, or it's not a very long walk. Or they get on the train at Parktown and they go into Parkway and they go into Luton Central, and then they just walk to the library. And actually, when we did the pop-up clinics initially, they were run out of Parktown, and we took everyone's postcode and we did a bit of mapping, and they came from all over. There were families that came from Northwell, Lewsey. So, and actually they were saying that getting into town is quite easy. So we know that some families they're in Northwell, they might not go to something in Leaguewave or Lewsey. The same, maybe if you're in Vauxhall, you might not necessarily go to Wigmore or Stopsley, but you will go into town. So that's why we are really looking at our central hub being our flagship hub. And as again, the app has loads of information on there. So where would you like a hub? Where would you like a hub then? There's rooms at the Dart station. Oh, right, we'll look at that. Yeah. Didn't know about that, but yeah. We'll work with Luton Rising and see what they can do.
Thank you. Councillor Hussain?
I know you would. I mean, I tend to agree with Terry, because success of children's centre was that people could just walk into them, and unfortunately with family hubs it's not distance in some cases quite one of the things that really discourages parents that we are trying to target. The thing that, I mean, it's encouraging that you managed to get 17,000, visit to it. My thoughts are, is it any way that you could do that a mobile area in a particular area where there is a greatest need, but there isn't any nearest family hub close to them for a walking distance? Can that be done? Have you ever thought of doing that? Because there are a number of children's center buildings that are still not utilized fully within the school buildings.
So we have hubs. So when the children's centres closed, the lots of the buildings were repurposed, and some, you're right, were within the schools. So we kept some of those. So we still work out. When I say we, I'm talking about Flying Starks. We focus on the 0 to 5, but we still work out of Fox Cubs, which is Foxdale and Dalla Road, Pastures Way Nursery, Whippley Infants in Farley. But that's why our model is that hub spoke and outreach. So those are our spokes. But if you look at our outreach, we've got over, I think, 30 outreach sites right across the town. So we're hoping that families can go somewhere to get information, but we're also working really closely with our primary care networks and our GPs, going to different wellbeing and health events. So we're trying to promote and increase access as much as we can, and that's one of the priorities with the Family Hub. So there's 3 priorities that we've got to focus on. One is access, one is connections, one is relationships. So it's always been about improving the access to different services and support, and the connections between those.
Yep. What I'm saying to you is that in terms of the need, there are certain parts of the town where, there is a huge amount of deprivation, and those people, to expect them to get, get on the bus to go to somewhere else, who are just about on the breadline, is to be trying to get them services in that area would be probably far more beneficial. Those that can afford can go even to Bedford to access the service. So that's the difference that I'm talking about. Where there is a greatest need, we ought to be prioritizing those areas so that, I mean, you mentioned Napier, the new development. Those people that are buying a £500,000 2-bedroom flat can afford to go somewhere, but those that can't even buy a 50,000 flat wouldn't be able to access those services. So I think we need to be taking that into account, the deprivation.
Yeah, so we did a Family Hub's needs assessment, local needs assessment. So we know quite clearly where the areas of deprivation in the wards that are most in need. So we have tried to target some of our support, and increase that in those areas that families were most in need. So, and then we'll give them some more support with regard to kind of their housing, debt advice. So we're doing a project around healthier, wealthier families, working with the Citizens Advice Bureau. So, and those wards and areas will be targeted.
Thank you. Tasleem Aslam.
With regards to accessibility, you see a lot of hubs, there's lots happening, there's lots of activity, but with accessibility, again, the timings, they all seem to be happening during weekdays, early mornings, where working parents, again, there is the need, but they can't access them because they have to go to work. Is there consideration? Is there much stuff? I mean, do you pay much consideration to those factors? Is there stuff put on weekends? I noticed there was like one activity one weekend when I wanted to access a hub. They all seem to be happening, Monday to Friday, where the average working adult can't reach a hub.
So that's why we've built the website and app, so the information is there. So there is a lot of online support. So we have something called like the Solihull programme, which is a lot of online support for parents. Our antenatal classes, we got feedback from parents, so we changed the way that and the times that was run. So they have we have twilight sessions and Saturday morning sessions. I don't think we'd be looking to extend that for all our services. We just won't have the staff, and we won't be able to afford that to cover those costs to kind of run things in the evening and kind of weekends like consistently, unless there's a massive sort of need. I think we're kind of a bit stuck at the moment.
Yeah, I mean, absolutely. You know, we would love to be able to do things at all times and all weekends. We have to be realistic, and I think when we're picking up around children's centres, even what we've got now, which is fantastic, doesn't compare to what we had with children's centres. So there is an affordability issue. However, you know, we do with the library, I think we've got a bit more potential because it's a library, it's open slightly longer hours, so we might have the potential to do some work outside of those hours going forward. We do know that we with Healthy Wealthy Families, for example, and those programs, they can contact families by phone, by Teams calls, Zoom calls, so we will be able to do some things in a more accessible way to families who can't necessarily come in person. We have a really strong virtual offer, and we've talked about the app and the website, but actually that virtual offer, we're going to be enabling things like AI, and I know people get a bit nervous, but just to be able to have access to service outside of office hours is really important. We use the example for infant feeding. You know, in the middle of the night, your baby's crying, you've got trouble with feeding. If we have access on your phone, on your, through your smartphone, through the app, that's going to be supportive. So we are really aware that it is an issue, but we are mitigating that in as many ways as we can.
Thank you. Councillor Begum.
Thank you, Chair. I think this is a really good report, but I think there are some gaps. So I can't see anywhere in the report anything about how we support teenage pregnancies. So that's one of my things, is how would you support teenage pregnancies? The other thing I wanted to actually ask, and you've got bits of information throughout your report, but nothing conclusive that I can put my hand on, where you talk about sort of like, I was thinking more along the lines of, if a parent or a prospective parent, somebody who's pregnant, is expecting a child and has perhaps a stillborn, the effects and the psychological effects after that, and how they access services and the impact of all that. And again, sort of like with miscarriages, pregnancy as a result of rape. I mean, rape can come in all sorts of forms. So again, how do we deal with the mental sort of health issues that impact a person resulting from these? I mean, you've got here consultant slots, and perinatal consultant slots. What are those about as well?
So we focused on the work streams that we were funded for. So the Family Hub programme is quite prescriptive of what we can deliver. So that's why teenage pregnancy is not included. But teenage pregnancy, we have a service that we fund through public health. But actually we have linked in the young mums that come under that service, and they are starting to access postnatal classes and parenting classes as well. So we're trying to make that more inclusive. So we are looking at what we can do more with that. And then you talked almost about like bereavement services and that. So we are starting to work, with the maternity ward at the hospital, because we know that's a big area. So that is something we'll be looking at doing this year. So and working with the Maternity and Neonatal Voices Partnership and the local maternity and neonatal system, because we do recognise there's a lot more that can be done just about support. So there'll be a lot more information support on our website as well, as maybe sort of producing leaflets and information after the families have lost a child. So yeah, we're looking at that.
I mean, it's all well, I mean, within the hospitals, you kind of get given all this paperwork, and it's like, okay, you can phone up all these services, but is somebody really realistically going to be in that mind frame that they're going to actually make that step. And the last thing you want is another statistics on your hand in terms of suicide due to mental health reasons. So it's kind of like with all of the things that we've kind of discussed today, one has a knock-on effect on another, and then again, vice versa sort of thing. So if this person has other children, then we're looking at those children could perhaps, due to postnatal depression, then get neglected, and therefore it spirals on, and dental health could be one of those appointments that gets missed constantly. So again, it's kind of like, how are we going to sort of like make sure that we don't have any loopholes where people are falling through the gaps, or because one service covers it and then another doesn't, or we're handing over paperwork. We can't expect that because we've done our due diligence by giving the paperwork, tick the box to say it's given, that that person is going to access that service, because really not always does a person express how vulnerable they actually are on the inside. The outside shows a completely different picture. The inside could be a totally different picture. And I think you might know more of what I'm talking about, in the sense that obviously it's that sort of thing, isn't it? And people don't always present the true picture on the outside, and therefore it's kind of like really tricky. But I am interested in knowing what these sort of consultative slots are as well.
So we've got we're working with CAMS and in our mental health partners, and we've got a parent-infant relationship team that will support families in their sort of perinatal period. So that's from like conception up to 2. So families can be referred into them or self-refer, and they'll get support with their well-being and their mental health, and but actually their relationship and their attachment with their child as well. So there's quite a lot of work going in to kind of develop that. So we've got child assistants, psychologists, psychotherapists, infant mental health practitioners. So there's a lot of support there, and we're now linking in with the perinatal mental health team and the perinatal specialist mental health team. There's so many teams to support family or parents that have got postnatal depression as well. And then there's also, with our Solihull, which is like our online support, there are online programs or guides that families can do at their own time. There's one about understanding your grief and understanding your trauma, understanding your baby's brain, understanding if you've got a preterm baby. So we're working, that's another issue with like working with the NICU, because those families, you know, they might have lost a child, or if their child's really poorly and they come home, that's a big adjustment. So, and I appreciate your comment that you think there might be gaps. This report was 50 pages initially, and we were told to cut it down to 20. So, yeah. So, yeah, there's and also there's a lot more that's probably going on that we couldn't include because we were trying to focus on the impact more rather than the progress. Yeah.
Wanted to come in, yeah.
Oh, yeah, thanks. Thank you, Chair. Sorry. Yeah, and I think also, dare I step outside my dental window, but I think it also starts as well with our GPs and our dentists as well. So what we're trying to do is make sure, and Nick and I are having a conversation today about connectivity and making sure that everyone within our ICS system provides touch points for patients, for our residents to go to. So it shouldn't really matter whether you come to our website, whether you go to the councils, if you go to GP, dentist, pharmacist, there will be someone who'll be able to guide that individual to go to the right place. So we're certainly trying to make sure that we're stepping up by linking in with our LDCs, our local dental committees, making sure that they're engaged, our dentists, and also our LMCs, our GPs and things like that, to make sure that clinically as well from a public health team, we are trying to cover as much as those gaps and as much of the system so our residents don't fall through them. So that's what we're trying to do at the moment. So, you know, we do a lot of joint meetings, not just with dentistry, but with all the other kind of services. So hopefully there should be a very small percentage of individuals who are falling through any gaps, if there are any out there at all.
Just the other thing that I was going to ask, thank you very much for that clarity. That is really helpful to have. And I do have a question for you after the meeting, though. So if you can hang about, please. In terms of CAMS, you said CAMS and how CAMS, I know CAMS used to offer the mellow parenting to deal with specific issues of sort of like the perinatal perhaps issues, if parents have gone through sort of like traumatic births and things like connecting with the child, or if they've had postnatal depression and so on. I don't know if they do it anymore, because I'm talking about sort of like more than 10 years ago-ish type of thing. But I know CAMS do have quite a long waiting list, and from people that I've heard from personally who have accessed CAMS, they weren't very happy with the services, firstly, and the fact that the waiting lists are just so long. So what assurances can you give us that people are going to be able to access services actually when they need it, rather than them being left alone for such a long period till it gets to a point where it is unbearable?
So there's something called the Ocean Team that deals with with baby loss or traumatic births. So that's in them. I don't know if they still do the mellow parenting, but that's with regard to kind of the waiting lists. It's why we've built in a lot of capacity into the CAMS team. So we've really expanded the 0 to 5 team. So I think I said we've got two child assistant psychologists, psychotherapist, an infant mental health practitioner, then a senior, and then another so there's a lot more capacity in that team, so which has reduced the waiting list. So, and they're delivering different support and more consistent support. So they've got things like Incredible Years, and then lots of evidence-based parenting programs. And then the other thing we're doing, kind of links in a bit with what Jason was saying, is we've invested in lots of different training across the whole workforce across the whole of Luton. So a lot of that is multi-agency training. So that helps with the relationships between maybe the GPs or our health visitors or school nurses or like CAMS or our support family workers. So in children's services, so right across the piece, so they're all coming together. So it's really is a partnership approach, but I'm hoping that the capacity in the 0 to 5 CAMS team, the parent information team, has definitely reduced waiting lists. So, yeah.
Councillor Keynes?
I hate to be a terrible nuisance, but I regard it as my responsibility to look after the residents of my ward. A hub, I've already said the Dart. There is a new building down there in Kimpton Road called Morton House. It has been taken over the ground floor completely by SEND, and it's got a cafeteria in it. So as far as I'm concerned, that's a perfect place for your hub down that way. Sorry for being amused.
Do you know about that? Is that Morton House used to be where Luton Rising? Did Morton House used to be where Luton Rising was based? They moved then? Like, I don't know about that. Okay, we can have a conversation. So yeah, I didn't know that the SND was in there. So I thought, it's
the newly converted building on Kimpton Road, opposite where Luton Rising's headquarters used to be. It's the one on the right-hand side as you go down from Vauxhall Way.
Let's take that away. Yeah, we'll take that away. Yeah. Yeah. All right. I'll see if we can get some space. Or definitely link in. Yeah.
Definitely go and have a look and speak to whoever is.
Yeah.
So we can't promise that it'll be a hub, but we can.
It's good to know. Yeah.
Spoke or outreach. You know, a hub is, it's not just the building. When you think about a hub, a hub has to have staff there from Monday to Friday, 9 to 5. The cost isn't the cost isn't just the building. Sometimes we just think it's the building, but actually, when you think of the investment you have to put into that. Yeah. So exactly, but we can absolutely, we can explore that.
And then the other thing is that some of the hubs or spokes, it's not about necessarily us delivering the services, it's about our partners delivering services and being part of that network. So, and all kind of giving the same consistent messages. So we'll certainly take that away. And they might do. Yeah.
Great. Thanks, everyone. Thanks, Jerry. I don't think there are any other questions or comments. So, and again, I think it was just a case of noting the report. So that's duly noted. Thank you. One more report to cover, I think, item 10, which is the Luton Children's Services IRO annual report, which is on pages 131 to 165 of your agenda pack. And that is with Sandra Thomas and Corinne Edwards.
Thank you, Chair. Just like to say I do need to leave by 8:15 because I have to collect my child. So if we go on, I will make my apologies and leave. So as you see that we have a very comprehensive IRO report, lots of activity in the IRO service in 23-24. You can see via the executive summary I have put in terms of the priorities and the improvements for the service moving forward. I would like to take the opportunity to invite Corinne. This is Corinne Edwards' report, and she is the manager of the IRO service. So, Corinne.
Good evening, everyone. I trust that you guys have had the opportunity to read the report, so I'm not going to be labouring on any issues, just to give a brief overview in regards to this year and some of the key messages, as well as some of the achievements for the service. I think it's important just to add some narrative to the report in regards to the work that the IRO service continues to do in supporting young people and their families. This year, you would have noted that we've had 1,064 review meetings for the 374 young people who have been accommodated during the period of 2023 to 2024. It is hoped that in the period of 24 to 25, this would be reduced with the introductions of the Families First programme. In relation to some of the key messages that we can take away from the period for that term or that point, we see that the number of young people who are turning 18 are increasing in comparison to those leaving the local authorities' care at the age of 25, and therefore it is going to be important that this is noted by the local authority so that services can continue to be in place, especially for those young people where there are concerns in regards to their vulnerability. We have the 18 plus IRO who continues to support the local authority and children or young people who are above 18. So it will be important for the local authority to recognise that and to ensure that ongoing support in that area can continue. In terms of ethnicity, you would have noted from the report that whilst the number of children coming into care continues to be from white background, the figures are increasing for children who are Asian, Pakistani and Black African. This have increased this period, and therefore it's about the local authority ensuring that they are adequate placement in regards to that. In relation to the IRO service, the IROs have ensured that where placements aren't appropriately matched, that this challenge is being made to the local authority so that adequate support can be put in place. In terms of the number of children and the age profile for those young people who are accommodated by the local authority, the data would indicate that between the ages of 1 to 4 years old, there's been a steady increase in comparison to previous years. This is above the national average for 2023-2024, which sits at 15%. Again, the increase in the age profile means that the local authority will be required to make decisions that's more challenging around placements, especially in ensuring that children and young people's needs are met. And that also includes for those young people who are transitioning to adult and social care. I think we heard earlier on about the importance of ensuring that our partner agencies are involved in transition as early as possible to ensure that the young people that we have who are making that transition are appropriately supported. In regards to permanency and achieving the outcome for children and young people, it is positive that this year we have seen an increase in the number of young people and children who have left care. Whilst it is positive, it is recognised that there is more work that needs to be done, especially for those young people who need to be reunified back home. The service continues to challenge care plans and encourage reunification where possible. The IRO service have continued with supporting and encouraging young people in ensuring that the service they require are in line with the Luton Pledge, and where that is not the case, escalations are raised within the local authorities framework. In regards to escalation, it is positive that this period, the number of informal escalation has increased. However, whilst we do recognise that formal escalation, there is work to be done. The relationship between the IRO service and social workers are improving, and that has reflected the concerns and how those are being addressed. Some of the feedback that we have received from some of the young people following reviews included the fact that they have a IRO who's able to allow them to express their voices and give them the space that they need to speak freely. Others feedback includes those from parents who feel that they have been involved in the care planning process. Whilst feedback has been something that has been introduced, it is yet to be fully embedded, but the local authority have taken on board the need to ensure that that part of the survey, that part of the process is being incorporated as part of the CLA review process. As part of IRO's role, children and young people participation continues to be an important factor, and that includes ensuring that children have access to advocate for meetings, as well as that independent visitors are assigned to children who are in care who requires that, in order to allow them to have that independent support from the local authority and also from the IROs. In regards to some of the key activities that we have completed this year, some of the activities include supporting the local authority with drawing policies and procedures, supporting the University of Bedfordshire in regards to training. We've also supported the local authority in devising clearer policies and procedures, especially in regards to the 18+ IRO role and services that is required. The IRO service continues to strengthen its oversight in ensuring that they are effective work being completed, especially around extra familiar arm, as well as the safeguarding around contextual issues. Another issue that we are very proud of is that in regards to our initial health assessment and key line of inquiry for children who become looked after, this has been increased, and as it currently stands is at the highest percentage it has been in some year at 69.2%. I think that's it for me. Are there any questions?
Could I just come in just with regards to one point? So Karen advised with regards to the reduction of our reviews for children in the forthcoming year, and due to family help. So as we know with family help, that's our national reforms, is about keeping families together keeping children at home. So we're not adverse to bringing children into care if they need to come into care, but there is a lot of work in terms of keeping families together. So therefore, nationally and locally, and we have seen a drop in our figures in terms of children coming into our care, we would see a natural drop in our reviews that take place. And as you can see from the figures in the report, we had spikes in the previous year. That has reduced last year, and it has reduced again this year to 358 currently as of today. Any questions?
Any questions? Yep.
Thank you for clarifying that point. So I've lost the page. So it was just on that then. So based on what you've just said and looking at page 28 of your report, so would the statutory looked after children reviews completed within the timescale set? So would you expect to see that improved or increase or decrease, probably the better word to use, decrease compared to last year? So I'm looking at last year's report, it was a slightly higher percentage. So I think you've answered it, but if I look at
yes, so obviously we strive to have 100%. There are some challenges sometimes if a foster carer or a child can't be present, so they may go out of timescale. The performance is over 90%. And we would see, regardless of how many children in our system, that we have figures of 100% in terms of reviews.
That's really helpful. So thank you. That's clarified the question. Thanks.
Councillor Mahmood Hussain.
Yeah, can I ask you, in terms of your Ofsted, and that was RI, and you're heading towards good, I hope. In terms of the IRO permanency, have you got most of them permanent or agency staff, or, is that stable now?
I'm really, really proud, and I say this with, that we've only got 2 agency staff in our IRO service, and that is due to the Family Help programme. So we have 2 of our IRO's child protection chairs gone over to the lead child protection programme in our Family Help. So we have backfilled, and that is it really. We have a very stable workforce in the Safeguarding and Quality Assurance Service. And in terms of the caseload? Right. So caseload currently, and it is cited in the report. So the handbook, the IRO handbook, sets out between 50 and 70. We are at just over the 70 mark for our IROs in terms of the children that they are supporting. Our child protection chairs, obviously we're changing the remit of those, and we've done some work in terms of splitting the role, because it used to be a dual role, in preparation for the implementation fully of Families First across Luton.
Thank you.
Thank you. Dirash, you wanted to come in on that as well?
Just a minor point. So the members of staff that have gone across as part of the Pathfinder programme, the backfill has been fully supported and funded by the Department for Education's grant to the local authority. So the additional cost for agency backfill hasn't fallen to the local authority.
Thank you. Any other questions, comments? No. Thank you. So, thank you for the report and for staying late to present it. And thank you for covering the questions. We note the report. Thank you. I think just the remaining items for us then are, when I can get my PDF to the right page. I think it's just a forward plan, isn't it? So yeah, the remaining item on the agenda is the forward plan, which is presented on pages 166 to 178 of your agenda pack. It's there for information. If anybody has any questions or comments as to what's included there, then let me know. And as mentioned earlier, the point that's being referred will be added to the forward plan, and we may need to move other agenda items accordingly. And on that note, if there are no questions or other comments, I think we can close the meeting. Thanks, everyone. Cheers. Cheers.